In the second session, we've got some more insights into the second session is around developing disruptive wellbeing and resilience products. So we're going to take a deeper dive in and actually having a look at the process of actually how you go about producing these and actually working with the LSA to enable that. I'd first like to hand over to my colleague Manish, who will be leading a session highlighting a number of companies that we've actually are working with the LSA and a number of the different products that they are developing. So I'll hand over to you now, Manish.
Sure. Thanks, James. Thanks for that. I really wanted to kind of take this session to kind of reflect on what we've been listening to as well, actually, because we've heard all about how wellbeing resilience is really important and how we need to challenge our ways of thinking of this as well and bring in evidence-based practice into this. And the University of Leicester sounds like a really good place to do it, thankfully. So I'd like to take this section to hear from some of the companies that are doing exactly that now. So moving on, if Andy could join us, please. Andy Yeoman's the director and co-founder of Focus Games. He's got lots of experience working, developing serious games, and I think some of them are seriously good fun as well. So I'll hand over to you, Andy.
Thanks, Manish. Is it okay if I share my screen?
Yeah, that's perfect.
Great. Just give me a shout if you can see something.
Yeah, that's all coming through good. Thank you.
Fantastic. Well, good morning, and thank you very much to Toru, James and Manish for inviting me here. So I'm Andy Yeoman. I am the director and a co-founder of a company called Focus Games. And during the next 5 minutes, I'll try and give you a whistle-stop tour of how educational games can be used both directly and indirectly to support well-being. It will include a little section on the brain fog app that James and Toru mentioned, but this is going to be mostly a general overview because we can't say too much about the brain fog app right now, and that's mainly because we haven't made it yet, so there's not an awful lot to talk about. Our company was started in 2004, and since then we've made over 100 different educational games and simulations. Now, much of our work is in healthcare, and the NHS is our biggest collaborator and customer. And you can see from this slide just some of the people that we work with to develop games. We make educational games that are intended to deliver medical education to healthcare professionals, staff training for all members of staff, and that doesn't just have to be in healthcare, patient engagement, public health campaigns. And the games are designed to be played by groups and by individuals, and they can either be face-to-face in the same room, they can be all remote as we are now, or they can also be used to support hybrid working. And the formula that we use when we're making any game really is that if you can test and deliver new knowledge and information, but also give people the confidence to actually put that knowledge into practice, you will help them to deliver some kind of improvement. The games that we develop are always developed in partnership with subject matter experts, and they're intended to spark discussions and to get people thinking. So they're mostly based on the written and spoken word. They're not meant to mirror mainstream education games, so entertainment games. So this isn't Super Mario, it's not Dungeons and Dragons. But that's not to say that they aren't enjoyable. They are still fun. They're intended to be enjoyable. And I know that we're all here to explore well-being. And some of our games do address well-being and mental health directly, but all of our games create enjoyable and memorable experiences. And so players nearly always leave feeling better and more positive than when they arrived, whatever the subject that they were discussing during the day. And it may also be useful to know that we use the games to gather feedback and data from the players. We don't just use them to deliver information. So we gather that information either directly through their actions while they're playing a game, especially the digital games, but also through pre and post-game questionnaires. So the games can be used for research. Our games are practical tools, and they're being used every day in hospitals, clinics, universities across the world to help people to address and solve real problems. So you can see here on the left a group of emergency medicine doctors who are playing an emergency department tabletop simulation. This tweet comes from a hospital library, and a lot of hospital libraries use our games in the same way that they do books and journals. So they lend them to members of staff throughout their organisation to support training and engagement. The games address a wide range of clinical and healthcare topics, and some are very technical, but they're designed for any age. So we're dealing with sort of adult professionals, adult patients, but also children and families. Our games, they're being played by preschool children and also by people in care homes. So we span pretty much the whole lifespan of a human being with games. There doesn't seem to be any limit to who will engage with a game or the subjects that we can deal with. The games are not just used for technical issues. They also address what you might call organizational and social issues, and they're a really good way of addressing what you might consider to be difficult subjects. So they're a good way to get people to engage in open discussions about emotive issues such as racism, sexism, domestic abuse, and a lot of these games are being used in the workplace to try and destigmatize some of these issues and make working environments more open and inclusive. The Brain Fog app, we're working with the Accelerator to develop an app that's going to help the public, but also healthcare providers to understand and manage long COVID more effectively. So the intention is that the app will help individuals to recognize that they may have long COVID, and also then if they decide they have got long COVID, what they can do to find help and support and also to help themselves. But the app is also intended to gather data from those people, so that can be used by researchers to help everyone develop a better understanding of what long COVID is, who's got it, how it's affecting them. And of course, this is still early days, so this we would hope will carry on into the future. I can't share too much information about it at the moment because it doesn't really exist, but I'm sure that the Accelerator will be happy to keep you informed and let you know what's going on in the future. Very quickly, because I realise that I don't want to steal too much time from other people, we have developed games and apps that address mental health directly. Working stress is one of them, and it's intended to help NHS staff manage stress more effectively, and it was based on research done and published by Birkbeck College. There's an app for individuals, so it's an educational intervention. There's also a board game which is digital and physical for groups of people to play and discuss work-related stress. And the board game was developed in partnership with the NHS itself. The MAP game is MAP stands for mental and physical health, and this is another game that was developed with the NHS, and it's intended to address parity of esteem. So how do we give mental and physical health the same weight and attention? And the workplace version is intended to encourage open discussions about mental health in the workplace. We developed this with quite a wide range of NHS organisations. Recharge is a new game, and it's somewhat unusual in that it's being used by inmates in prisons in the USA, and it's intended to help them maintain a healthy and functional relationship with their friends and families outside of the prison, so that when they're released, they find it easier to integrate themselves back into society and their normal lives. Now, I realise that I may have spoken a little bit too long, so James, Manish, would you like me to end now?
That was perfect, Andy. Yeah, it was a really good insight into exactly how we can use different tools like gamification. Right, thanks for that. Is it possible for Linda to join us now? Because I think Linda's one of our other exemplar companies. Linda's devoted a career to mental health sector with over 26 years of experience in the NHS, up to the role of director in adult mental health services. and she's now going to be talking to us about a company called SanaMente. So over to you, Linda.
Thank you, Manish. Is there any chance at all that you could share the slides for me, if you don't mind?
That's totally fine.
Technically challenging me. So, as Manish kindly said, I am a nurse by background, and I have worked in the NHS for 26 years. I left 10 years ago and set up in private practice, and we deliver a service around talking therapy, coaching and hypnosis. And during my years of working in the NHS and in private situations, the thing that is overwhelmingly seen with clients that I work with is its social situations impact so significantly on their mental health. Coping strategies are in some way lacking, and the over-medicalisation of some situations where sometimes it's a good friend, a good piece of advice, or some direction that someone needs, but they end up in a system where they become medicalised, and that then leads to frustration, anger, and then stuck on a cycle. So when COVID arrived, that gave me the absolute fantastic opportunity to take some time to think about how I wanted to help people to be the best that they can be within a framework that is supporting a positive prevention, a way of assisting people to not become unwell and to maintain their well-being, build their resilience and be the best that they could be. Could you move me on to the next one, please? So what we did was we designed a online platform. It's called Strive with SanaMente, and it's designed to help members access the information that they need to be the absolute best that they can be. And we've done that in a way that I'll go on to show you how we've done it, but we've done it in a way that we think is accessible and it's usable, and you can use it 24 hours a day. On top of giving people the access, what we wanted to do was create a community where people could help and support each other, and to help people with the challenges that they face on a day-to-day basis. Our materials and our interventions are curated by NHS mental health trained professionals, and our resources are managed and monitored throughout the whole process. If you could take me on to the next one, please, that would be great. Thank you. So the problem that we think that we are trying to address is that there are more than 1 million people waiting for mental health treatment. And as I said earlier, some of those people are being overly medicalised, and to help people be resilient, be able to manage their own mental health and their own emotions, their own social circumstances, we believe is a way to help them be the best that they can be. We recognise that the impact of poor mental health is significant across the workplace. So with 70 million days being lost each year to employees through sickness absence, and also 15% being lost through presenteeism, we're aware that we really did want to do something to help people be engaged at work as well. Moving on a wee bit more, please, Manish. Thank you. So our online platform, our solution, has been designed around the 10 keys of happiness, and this goes back to what Professor John Motley was saying. It's around those keys that will help you be interacting with your community, interacting with your workplace, challenging you to be the best that you can be, to accept who you are, giving you a bit of direction, and looking at how you manage your emotions as well, and building resilience. The 10 keys of happiness were designed about 10 years ago, and they've kind of, in some ways, they've taken a life of their own, and in other ways they've not been used to their maximum benefit. So we thought that these would be an ideal framework for us to design our platform around. So next one, please, Manish. Our underlying principle for the whole of the platform is about compassion, and it's very firmly helping people to understand that compassion is the glue that holds the world together, that for us to be the best that we can be, we have to be in balance with our compassion. There are 3 flows: from us to the world, from the world to us, and from ourselves to ourselves. And if we can manage that, if we can manage ourselves within that framework, using the 10 keys of happiness, we have a really strong profile, if you like, our framework of helping people to understand themselves. So the components of compassion that we talk about are kindness, understanding, dignity and respect, but also exercising wisdom, courage and strength. And none of this is easy. None of this is simple to do by a self-help book. Sometimes you need to be guided, directed, and you need to have a process, I think, to understand yourself and a way of assessing yourself so that you can prioritise what you need to do next. And that's what our platform does. If you move us on again, Manish, please, that would be great. So how it works is that we have a wellness assessment. You take the wellness assessment, the wellness questionnaire. There are 29 questions within that, and it covers off a number of areas. It covers off your emotions with yourself, your image of yourself, how you're reacting and responding to situations. It covers off your finances, your relationships, your work relationships, and generally where you see yourself in the world. So it gives us quite a good social overview. From that assessment, we then direct people to learn from the information that's available on the site. So each key of happiness has been set up in a way where you have an information video that explains what this key is about and how to best apply it. You then have resources, information sheets, and you then have activities. And we will direct you to the information and resources that you need to work on whatever the area is that's been identified in your wellness assessment. Now, it may be that you're doing really, really well and you're looking to be promoted, and it might be about meaning of life and purpose and direction that you need attention in. Or it may be that you're in a very stressed situation and you're looking to manage your emotions and to manage your relationships. So we help the person to set up their action plan, to apply the changes to their everyday life, and then we help them to review and reflect on it, and to just discover whether the technique they've used has been effective. If it's not been effective for them, then we will direct them to something else. Can you move me on to the next one, please, Manish? Thank you. So in terms of the resources that the individual will be able to access, there's a membership package for everyone, which means they have full access to the online resources. We have a corporate solution, which I'll talk about in a wee minute. But with the membership package, there comes the access to the resources, a monthly newsletter. We also have a webinar that runs every Tuesday, and that webinar is around fitness, activity and health generally. We support individuals it's about holding people to account, really. So if you are someone who is looking to get more involved in exercise, or if you're someone who's looking to be more involved in reducing your weight or managing your food, then that's what that group's there to do. We gently hold people to account and we support them to make the changes that they want to do. And we operate a framework where it's basically we're looking to make one change and do that consistently. We also do some guided relaxation, some guided visualization in that group to help support the people to make the changes that they want to make. We have a members only Facebook group, and within that Facebook group we generate conversation, we generate activities, and we follow a key of happiness per month. This month we are following energy, and when we move into December we'll be looking at giving, and we're looking at promoting meaningful Christmas in a way that supports people to manage their finances, manage their emotions and feel as good as they possibly can whilst giving over the festive period. We have audio and video content, and we have a live rest, reset, refocus event which happens on a fortnightly basis. Those cover off keys of happiness per month, and we have industry specific speakers who will come along and help us understand how best to address the situation that we're working on. This month we've been doing energy, so we've had a personal trainer help us be more active during the day without having to go to the gym or take up running. And we've also had someone talk to us about gut health and how to manage your immune system as effectively and as healthily as you possibly can. We also include relaxation events within the rest, reset, refocus. We have three monthly progress reviews, and we also engage with people with interactive text by WhatsApp. And the members have a fortnightly one-to-one support session should they want it. And that's really to just keep them directed in terms of which resources to use and how to use them and monitoring their progress. We have a corporate solution, and we are currently working with companies across Leicestershire to pilot how to apply it to their workforce and to monitor any improvements. Now, we're early days. we only started in September, and we're hopeful that our joint working with Leicester University is going to help us look at how we can do this better and how we can monitor the impact that we are going to have. I know that's been a bit of a whistle-stop tour. I think that's me at the end. Happy to take any questions at the end, and I hope it's made some sense.
Thanks for that, Linda. That was really good. It shows how we can use different platforms like this to kind of get some ownership over our sort of mental health and well-being. So it's really good. Peter, could I have you on next, please? So as Linda mentioned, if you've got any questions, just drop them in the chat and we'll pick them up at the end in the panel Q&A session. Peter's the sort of CEO of Third Space Solutions, and they set up in 2018. Over to you, Peter.
Yeah, thank you. And the sun just come out over here and it's glaring right in my eyes. Anyway, I think I'm okay. The glare's gone. Thank you. Good morning. I feel a bit of a slight, well, I say fraud's a strong word, but I feel the odd one out here because I'm not a doctor. I don't come from the medical industry. But as a company, we set up to provide solutions in the workspace. And ironically, in a sort of current pandemic world, we often refer to COVID as being the ultimate disruptor that keeps giving. And it's having a major impact on the way that we work and what we do. And that's having a knock-on impact on mental health. If you just flash through to the third slide, please, ticking time bomb. We do quite a bit of work with Aeon. Can you put it on full screen, Manish? Possibly. Thanks. Yeah, we do quite a lot of work with Aeon in the US, and some of the stats that are coming out, and this is pre-COVID, about the number of days lost in the UK to illness and various other sort of issues. The previous speaker talked about 70 million. Aeon came up with a figure of 91 million. I think either or, they're still very big numbers. So this is a real problem, and there's no doubt been impacted further by COVID. Next slide, please. Manish, thank you. So just to back up what Manish said, we started in 2018 to provide solutions in the workplace. And the driver for that was that open plan office design was causing serious impact on the way people worked in their daily lives. And those who were introvert wanted to go and find a quiet space, obviously didn't want to work in an open plan environment where there was noise and distraction. So we started providing solutions for the workplace. And we started by doing it in exhibitions and conferences by using meeting pods to create a quiet space to have a meeting, and that quickly morphed into other areas. In 2020, we launched our first workspace lounge. Again, this is at the NEC, and currently we'll go a bit further on that we're now taking that concept into the high street on the back of a lot of us now working remotely, working hybrid, and we're still looking for quiet workspaces to go and do our jobs. We design our own pods. We have them manufactured in the UK and other parts of the world. So we provide a range of pods both into the public and private sector. And the key driver from the client side is our employees want quiet spaces to work. Next year, and this is where our relationship with LLSA comes into play, is that we are launching MindSpa. One of the things about pods that we found was that not only could it be a pod for making a phone call or having a meeting or do a quiet work, the pod created a quiet environment that was private. So we could start looking at the application of how our pods could be used. Could it be used for a consultation with a doctor or a nurse? Could it be used for a consultation with an AI bot that may be a mental health assessment tool? Could it be used for playing content that was all around mental health? And the notion of having a pod that could create that secure and private space became quite interesting. And that's really what we're working on right now. So in 2022, we're going to see our company morph from being primarily a business that supplied furniture, pods, into now looking more at the application of how our pods work. And then we're partnering with various companies who have interested tech, AI, technology, or content that we can use our pods for. Can you flash forward one, please? So that's just a bit of brief background of our lounges. I won't go into what they are, but you can see in the background there, pods play a big part. And when you come into our lounges as a client, everybody makes a beeline for the pod. So that's a clear indication that people do want to work in those quiet and private spaces. Next one, please. This is our newest pod, and this is a pod that can be bookable via a platform, and you're going to start seeing pods like this in high street retail environments, airports, railway stations, and again, it's targeting that whole remote worker or hybrid worker who wants to use a touchdown space other than the Starbucks or a Costa Coffee or even McDonald's to make that Zoom call and do some quiet work. Next one. And this is what we think is the game changer. This is a product called MindSpa, and it's through our collaboration with a partner, a design partner. The MindSpa is the physical space to go and have a mind workout or a brain workout, and the idea being that it creates a comfortable, quiet, physical space where people can engage with content that's all around. I'm not saying improving their mental health, but combating the impact and looking at positive solutions that will help them cope with those mental health issues that they might be experiencing as a sort of preventative solution. Next one, please. And we've partnered with a company called Synctuition. If you know the mindfulness app space, you'll be familiar with people like Headspace and Calm, who are global leaders. Synctuition come in at number 3. And their approach is very different to the other sort of players in this space. And within our MindSpa pod, the idea being is that you can sit there, put on a set of headphones, and you can engage with journeys which are recorded in 3D. So the whole idea is that when you sit down and relax for 25 minutes, you're going on a journey. And that journey, there are 120 of them, are all linked to parts of your life. So either are journeys for travel, there are journeys for education, there are journeys around a lot of topics that will take you back to maybe a positive time, an enjoyment time, and it's all around really just giving your mind a rest from that busy working day, so you can recharge the batteries, you can come out with a clear focus, or maybe it's just a case of getting a better night's sleep. So really, it's about preparing you to help to cope with the environment around you. But what the pod does, it creates that quiet and safe space. And what we're doing right now with LLSA and at Glenfield is we already have our existing pods at Glenfield, which are being used by healthcare professionals. Our next phase of that would be putting in a wellbeing pod, a MindSpa, and with content. So rather than stepping into the restroom, which in reality is quite noisy, you're stepping into a pod, putting on your headphones and having a 15 to 25-minute break. So that's what we're doing. But on the top of that, and what we're quite keen and open to do is looking at other applications of how MindSpa and our Opus pods can be used in a range of different environments around treatment therapy, and how content can be used to actually help people in post-op recovery, or if they're having chemo, can we take them away from that current situation and put them somewhere else where they can have some enjoyment whilst undergoing a treatment that may be distracting and may be quite painful. That's it. Thank you very much.
Thanks for that, Peter. That was really useful. I think it was also really interesting because you touched on a lot of the stuff that John talked about earlier with environmental mastery and how that can kind of really contribute towards stuff. So thank you to all our speakers who've kind of just contributed to this session. It was a quick 5-minute introduction to each of the companies, kind of give you an idea of what the different ways you can think about well-being and resilience, and different products that you can then use to kind of combat that as well. James, over to you.
Thank you. So I'd just like to thank all the speakers, so Andy, Linda and Peter, for really insightful discussion there. And I think it just goes on to sort of reflect the theme of the day, that actually resilience and well-being is such a broad topic, and its applications can be very varied, whether it's app-based, whether it's pods, or the application of games.